The North Alabama Medical Center in Florence told Way 31 it's seen huge success with the monoclonal antibody treatment for COVID patients. Way 31's Breken Terry spoke with the hospital today to find out exactly what this treatment is and why it's been so successful. Breken?
Back in November, the monoclonal antibody treatment was given emergency usage authorization by the FDA, and since then the hospital has been using it on mild coronavirus cases. Now, out of the 500 people they've given this treatment to, only 12 have had to be hospitalized.
It's lab produced, and what it does is it mimics the actual antibodies in the body. It doesn't allow the virus to continue to reproduce once inside the system.
This is a peek inside the hospital's monoclonal antibody infusion treatment. It's a series of lab-made proteins given together in an infusion like this. It's an outpatient treatment that hospitals are seeing a lot of success with, but it must be given in the first 10 days of symptoms to be very effective.
We've seen less than 3% of the patients that receive this outpatient infusion come back to be admitted, and that's been critical for us right now. As just with every hospital, we've been so full and so overrun with COVID.
North Alabama Medical Center's Casey Willis said people with coronavirus who have underlying conditions like diabetes, heart issues, or are overweight qualify for the treatment once they're diagnosed with coronavirus.
It's a great way to keep patients that are at a higher risk of developing complications from COVID, to keep them from getting so much sicker and ending up in the hospital.
Willis said if you get coronavirus and are over the age of 55 with an underlying health condition, your doctor can refer you to the hospital to get the treatment. She said this gives hope that COVID isn't a death sentence for those vulnerable to the virus.
People that have called us a day or two after they got the infusion therapy and said, I feel so much better. I feel so much better. I'm 100 times better. And so it's really gone a long way to give patients hope, but also, you know, it's just a really good line of defense.
Now, Willis said the biggest key in the success of the monoclonal treatment is an early diagnosis of the virus and then calling your doctor to get the infusion as soon as possible. Live in Florence, Breken Terry, Way 31 News.